America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer, Mr. Darren Wilhite. I'm your host, Carrie Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. We want to welcome KLIN AM 1400 FM 99.3 in Lincoln, Nebraska, our newest affiliate. Happy to be in the Cornhusker State with all those folks. Glad to be on the air up there. If you want to follow us on Facebook or Instagram, you can do that at America's Healthcare Advocate. And as I say each and every week, we are on every podcast platform, I think, known to man. So we're on Pocket Cast, Spreaker, Spotify, Google, RSS Feed, TuneIn, Apple Podcasts, SoundCloud, Stitcher, Overcast, Pandora, and Amazon. We are also on YouTube. All right, today, joining me in studio is Rachel Arnett, and she is the Vice President of Sales for Blue Cross and Blue Shield of Kansas City. It's only taken us, Christina Lively's in studio too. She's the Marketing Vice President, Director of Marketing. How many years did it take to get her up here? I'm not sure. It was a long time, huh?
It has been a long time. I'm happy to be here today.
We're very happy to have her here. So, a little bit about Rachel. Rachel's Vice President of Sales at Blue Cross and Blue Shield of Kansas City. 17 years at Blue KC. She has served in a variety of roles within the sales organization, including Director of Sales and Senior Account Executive. She's accountable for the strategy and management of territories within Blue Cross and Blue Shield's large group portfolio. She serves on the board of directors of First Call, an organization dedicated to providing support and resources for families affected by substance abuse. Rachel also served as the former president and board member for Friendship Inn, a home away from home for families and patients at the University of Kansas Health System. In 2017, she was recognized as Ingram Magazine 40 Under 40, a list of emerging Kansas City leaders. She is a member of the Greater Kansas City Chamber of Commerce Women's Leadership Committee, and she has a Bachelor of Arts degree in psychology from Rockhurst University and a Master's of Business Administration also from Rockhurst. Once again, welcome.
Thank you. Thank you for having me.
Well, let's just kind of dive into this. There's a lot going on in the marketplace right now. We're going to talk about some of that regarding Humana and some of the other things a little later on in the show, but you know, the thing about Blue KC that's always been kind of, I spent 27 years as a broker that I've always thought was different from the way a lot of other carriers behave is how you interact with the broker community and why the medium and small broker, not just the big guys, but the medium and small broker, which we were like the medium-sized broker, why those are important to Blue Cross and your distribution model. So talk a little bit about that, Rachel.
Yeah, so the broker community is critical to our business here at Blue KC. We are very focused on how the broker is really that connection between us and our end user. So whether that's an individual member that's a ACA member or a Medicare Advantage member, but also our group business. So small group, large group, they are critical, and we continue to leverage them and work on those relationships with them to ensure that we're hitting the mark with their customers and what their customers need.
Yeah, and you know, I think when you said hitting the mark, I think that's a really important part of this is being able to let the brokers have direct communication. One of the problems that we experience with a lot of the other carriers is if you want to know anything, you got to go to the broker portal. Well, you'll wait, and you'll wait, and you'll wait some more to get an answer back. Blue KC is very different. You're very different in that respect, and you're different in customer service. So talk about that, where brokers have direct access, and then talk a little bit about customer service.
Yeah, so we have boots on the ground in Kansas City. So we have small group sales team that they're out, Mike and Craig, there are small group sales reps that are in those brokers' offices. And if they're not, we need to get them out there and talking with all, you're right, the big brokers, the small brokers, to get feedback, to hear where are our products hitting the mark, where are the products needing some additional emphasis. And then also we have our large group sales team. So we have our large group sales team, 100+ team that also is in the market getting feedback and understanding what is most important to our brokers and our customers.
Yeah, you know, it's a little different than having to call the head shed in Minneapolis or in Louisville, Kentucky, or you know, wherever the headquarters is for the other carriers. It's a little different here because Blue Cross is here in Kansas City, 85 years right down on Main Street, and we kind of like to emphasize that to people, that local connection is really important.
It is important. When the customer or the broker, the end user member is calling Blue KC, they're talking to someone that is here in Blue
Yeah, and you're
KC.
actually talking to someone.
Yes. Yes.
That's another thing. It's not 42 voice prompts and then we'll get back to you. You actually get through to somebody.
Right. And then also, if a broker calls our team and says, hey, this member is having an issue, we need your help resolving that issue, we can have our team walk to that customer service rep and talk to that rep to help also with the resolution.
Yeah, I remember back in the day when Tom Maupin was here, and he was my go-to guy. And if I had a problem and we couldn't get it solved, I would pick up the phone and I would call Tom. And I always found it amazing because usually within 24 hours, we didn't always get what we wanted, but we got an answer, okay? Right. And most of the time we did get what we wanted. But again, being able to have somebody that you can go to when you're the broker because you've got a client on the phone to you angry about a prescription drug they can't get, and it turns out that the pharmacy coded it wrong, which most often turned out to be the case, right. And then would call Tom, and Tom would go back and pull it and go, well, they just coded it wrong. We had them recoded, and everything's going to go through. It's a simple thing.
Yes.
But it's not simple to the policyholder on the other end of the spectrum, and it's certainly not simple to the broker who, is getting his ear chewed off.
Right.
Usually it's the owner of the company's wife, okay, or somebody, yes. In the ownership level who's having the problem, and then you're in real deep trouble with your client.
Yes.
So having that connection, I always thought was critical, and I think the point, we're talking to brokers with regard to this, but to the clients out there, the other side of that thing is that you're here, okay. You're not some distant call center, somewhere else in the country. You're right here in Kansas City.
That's right. And we are 85 years here in Kansas City, and we're here in Kansas City to stay and committed to our broker partners and our customers here.
Yeah, we'll talk about that part about here to stay when we get into a little later in the segment, some of the folks that aren't going to be here to stay next year and what's going on there. Another thing that I always thought was interesting, and you mentioned Medicare as well, is you see these giant advertising campaigns going on year in and year out almost now regarding Medicare, and it's a call center. And I always say, well, when you call them up and you ask them, can you tell me about the hospitals north of the river? And then the person on the other end of the line goes, what river? What do you
right.
You have a pretty good idea. They're not here. So they don't know it's North Kansas City Hospital or Liberty Hospital. That's a big difference with Blue KC.
Yes. The people that are answering the phones, whether they're on our sales team or they're customer service reps, they live and work here in Kansas City. So you're right. They know where north is, where south is, and they know the health systems here in town to help our members.
Yeah, and again, when somebody asks that question, oh, my doctor's at so-and-so hospital or my provider's at such and such a hospital, you have to know where that is and before you can answer that question satisfactorily.
Yes.
So they know they're getting what they're paying for, not just signing up for something and they find out after the fact, oh, Lord, we're not in the network. We didn't know that.
Right. And it also helps them navigate to help members pick the plan that works best for them, too, also from an enrollment perspective.
Yeah, and that's something else we always tell people that, if they do have questions about that or they don't have a broker, they can always call you guys direct. And you're happy to walk them through the process and just tell them, here's what you have or here's what you don't have and here's what we can do.
Yep.
So that's important, I think, for folks to understand. All right, when we come back to the break, we're going to get into a little more of these topics. So we're going to start this conversation now about what's going on with Humana and the fact that they are leaving the small group space. And what is that going to do to the marketplace? And how does that affect you if you happen to be a Humana policyholder? If you're an employer, these are group health insurance policies I'm talking about. So when we come back to the break, we'll chat about that. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We'll be right back with more.
The Golden Rule: treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make: serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. And the shows are on all of those podcast platforms. There are 12 of them, along with YouTube, if you want to go up and listen to it afterwards. By the way, if you want to send me an email, and I get a lot of emails, I answer each and every one of them. Not the same day, but I do answer them. It's americashealthcareadvocate.com. Go to the website. There's a portal on there. You can send me an email if you've got a question, comment. If I can help you with something, I am happy to do that. So please feel free to connect with me, and I'll be happy to do whatever I can to help you. In studio with me, Rachel Arnett, VP of Sales, Blue KC. We are talking about all things Blue Cross and Blue Shield of Kansas City. So you're one of those employers out there with a Humana plan, and you really don't know. Maybe you haven't gotten your letter yet, whatever the case may be, but it's all over the news. They are pulling out of the marketplace. If you want to know about your options, you can call Blue KC at 816-395-2939, 816-395-2939, or the website, bluekc.com. Look, don't wait. This is what people do. You procrastinate till the last minute. Don't wait until the last minute. And they've got some incentives, which I'm not going to tell you about now. I will tell you about it in the next segment. They're going to make it very attractive for you if you want to move off of that plan onto a Blue Cross and Blue Shield plan. Once again, phone number, 816-395-2939. So one of the things that you talk about, and we're going to talk a little bit about how that's illustrated in some of the things you do, is patient-centered healthcare coverage. So that's a little different than a lot of the other carriers. In fact, it's a lot different. So let's talk a little bit about that.
It is. So we have a SpiroCare that is an exclusive primary care access for members that have access to the SpiroCare plan with their Blue Select Plus network. And this is unique in that members can go to SpiroCare and have low to no cost care. That could be for sick care, primary care, behavioral health services. This offers members access to a model that is not about getting members in and out, but spending time with our members. So what do they need when they come? So we're meeting our members where they're at with each visit.
So I have a quiz for you. What's the average amount of time a person spends with their primary care physician in the United States of America?
I think it's less than 15 minutes.
It's 7.5 minutes. You're halfway there.
All right.
So the reason I do that is because at SpiroCare, you usually spend 45 minutes to an hour with your physician or the PA or whoever you're working with. It is, I've been to the centers. I've got people that I know that access those centers now. And they are just completely, it's a different model. It's primary care in a way that you are not used to getting primary care, I guess is the best way to say that.
Yes, I agree with you. The moment you walk into the care center, it feels different. And then once you're in with the provider, it feels even more different than a typical primary care visit.
Yeah, and you've got care guides. And talk a little bit about those because they are really important because people have a very difficult time navigating this system. It's complicated as hell, our overall healthcare system, and it's just very, very difficult for people. Talk a little bit about the care guides and how they help them navigate outside of SpiroCare if they need things that are not inside of SpiroCare.
Yeah, so SpiroCare care guides, they are responsible for really helping navigating any questions around insurance coverage. So you have a question on your deductible. What goes towards the deductible? What goes towards your out-of-pocket maximum? They'll help with that. And then also, if you need a visit with a specialist and follow up to your visit at SpiroCare, they would help identifying what specialists are available in the network and then go above and beyond and actually help in scheduling that appointment. So taking that complexity of getting that next step care out of the...
Instead of you calling the dermatologist or the MRI and said, we can get to you in 90 days. I mean, it's a little bit different when the SpiroCare care guide picks up the phone and makes the call. And gets an appointment. So, and one of the reasons I want to point that out is because it is available to small group. Okay, medium-sized group. You've got a lot of large group clients in the city that are on it, been on for a long time. There are 11 different centers throughout the city, so let's see if we can go through them, or
Yep.
most of them.
So there are 9.
No, okay, I thought it was 11. Okay.
Yep. So our most recent addition was Independence.
That's the one.
So we have Crossroads, we have Lee Summit, Olathe, Shawnee, Wyandotte, Liberty, Overland Park, and Tiffany Springs.
Okay,
So
so-
we have blanketed the city.
Yeah, it is really literally almost anywhere you can have access to this. Independence was the last one that we were kind of, now that kind of covers everybody. So
Yes.
they're available. You can pick up the phone and get an appointment the next day, whatever you need to do. But it is full primary care. There's also a piece that Rachel mentioned we're going to talk about for just a minute, and that's behavioral health, because there is no other primary. There are other primary care clinic models out there, but I've not seen one that has the level of behavioral health. Talk a little bit about that, because I know that's a big deal with mindfulness and some of the other things that Blue KC is dedicated to doing. So chat a little bit about that.
Yeah, so our behavioral consultants that are in our SpiroCare centers are a differentiator. So member could be meeting with one of our primary care nurse practitioners and articulate that they have a need for that engagement, and that engagement can happen right in that visit. So the behavioralist can come in and have that interaction with the member to address immediate need or help them navigate care outside of SpiroCare.
Yeah, and mental health issues are a big deal. It's something that we have a tendency to kind of sweep under the rug. And the nice thing about SpiroCare is you actually get to sit down confidentially with somebody. It's not a Zoom conference or a telephone call or in a waiting room with 15 people. You actually get to sit down and have a face-to-face conversation if you're having a problem and go through that problem.
Yes. We are all about at Blue KC, really beyond the SpiroCare, of reducing the stigma around behavioral health needs. So this is another added value service to SpiroCare that's been very valuable and utilized heavily throughout our membership.
Yeah, and it is available also to children, is it?
Yes.
Yeah, and that's kind of important to know.
Yes.
Yeah, because a lot of parents, if they're having problems with a child and they want counseling or they want help, they really don't know where to turn.
Right.
And if you're in SpiroCare, then you have that opportunity.
Yes.
So if you are one of those small group employers out there, and you know you're going to have to make that change and move off of that Humana plan, which I promise in the next segment we will get into, and we'll talk about the incentives. This is a model you want to take a look at. You heard Rachel say it. It costs less. Well, that means it costs your employees less, okay? It offers a wonderful benefit, and you've got a one-stop shop for you. They can also get prescription drugs there, correct?
They can.
Generics.
Yes, that is true. But we are leveraging the pharmacies as well. So that's another piece that the care guides can assist with. If they need to get a prescription filled outside of the care center, that is something that can happen as well.
And they can get labs and x-rays at most of the facilities as well. So
That is correct.
Again, like I said, it's a one-stop shop. So I urge you, if you're one of those folks looking for coverage like this, to get on the phone and give them a call and learn a little more. You can go up on their website. They've got great information up there about SpiroCare. Go up there and take a look at it. The satisfaction rate from people that I talk to is above 90%. And people that are in the program love it. Once they get in it, they're like, we're never going to leave it. So it's an excellent program. They do a wonderful job with it. If you want help, you can call 816-395-2939 or the website, bluekc.com. We'll be right back with more. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com, americashealthcareadvocate.com. You have a question, a comment, send me an email. I'm happy to answer it. My producer, the always perfect Mr. Darren Wilhite. I'm your host, Kerry Hall. In studio with me, Rachel Arnett, VP of Sales from Blue KC. We are talking all things Blue Cross and Blue Shield of Kansas City. Again, if you're an employer out there and you're concerned about this whole, we're going to talk about this whole Humana thing in this segment, but if you've got questions, pick up the phone and call them, 816-395-2939. They'll be happy to help you, 816-395-2939 or bluekc.com. You heard us talk about SpiroCare in that last segment. I really urge you to take a look at that. It's a very different model. It's extremely affordable. like I said, the satisfaction rate from everybody I've talked to is over 90%. People are thrilled with the way the clinics are run, the time they have with the caregivers, how they help. I'll give you an example. This is a true story. I had a broker who put his whole company on SpiroCare. His son goes to the SpiroCare facility in Shawnee, I guess it was, on a Saturday, and they couldn't do the x-ray. There was something wrong with the x-ray. They gave him a gas card so he could go to the other. It was the thing that they were willing to do something like that to cover his cost of having to drive to the next SpiroCare facility. He was like, Carrie, once I heard that, he said, we're never getting off SpiroCare. But that's the difference, okay? It's just a level of concern and care, and it's very, very different. So, again, 816-395-2939. All right, so the big announcement, Humana's exiting the marketplace. What did we say, about 60,000 members in the Kansas City metro area, and all those people are going to lose their coverage. They're going to be forced to make a change. Let's talk about what Blue KC is going to do to help people in that transition. I mean, you guys are doing some pretty exciting stuff that really, I think, means you need to take advantage of this now. And by the way, brokers, you're listening to this, you need to get on it and get on it now. So that your client will turn around and go, gee, you did a great job for us. But let's talk about the incentives and what you all are doing, because it's pretty cool.
Yeah, so obviously you mentioned SpiroCare. So we have a lot of SpiroCare offered, or SpiroCare plans that are accessible to these small groups. So that is a great incentive for these groups that are looking for an alternative option. For groups that have received under a 15% increase in their renewal, this most recent renewal cycle, we will take that renewal and we will match those rates so that they can have those rates locked in through the end of 2024. So that's a critical cost stabilization that we will be able to offer to those groups that are looking to make a change.
So essentially till 1/1/25.
That's correct.
Yeah. So that's pretty generous. You basically locking them in. They're not going to get an increase. I mean, if you do that now, you're looking at 18 months, whatever that is.
That's correct.
Yeah,
it is.
When's the last time you got an offer like that, people? That's pretty amazing. So that they're going to get locked in now, and it's going to carry through 1/1/25 if they come on board.
Yes, that's correct.
Okay, and they can either do that through their broker,
yes,
which we're hoping all the brokers out there are getting the message, okay, and understand you've got an opportunity here to do something really good for your clients. And guess what? You won't have to go through that renewal again at the first of the year, which is always a fun time if you're a broker or an agent out there. So this really gives people a tremendous opportunity here.
It does. And there are multiple different funding platforms that we have. So that 2 to 50, we have our ACA plan offerings. We have 5 to 99. We have the level funded ASO, which I know most of those or many of those current Humana customers are level funded ASO customers. We also have insured options then also for 51 to 99.
And we'll talk a little bit about what that option is for 51 to 99.
So those, we have a whole slew of product offerings. We have seen a great increase in new business coming over to Blue KC starting January 1, 2024 or 2023. And that is due to us making some product enhancements or changes that have allowed for a lower price point. So we've increased some of the deductibles and out-of-pocket maximums on some of the standard product offerings so that there are some more affordable options that small group customers and brokers can evaluate.
Yeah, and the people that get hit the hardest typically are the 1 to the 49s. That in the marketplace, they're the ones that just get obliterated, unfortunately. I mean, some of these increases you see coming through from some of the carriers that people are receiving are 20%, 25%, 20. I saw one the other day for 38%. It was out of state, but it was like, seriously. So what I always say about Blue Cross is there's a plan that has the benefits and the cost that will fit your budget. I don't care who you are.
Right. I think we see that that shift in that kind of 5 to 50, where they are currently on an ACA plan, but then they look at the level funded option and they can look at Blue Select Plus, SpiroCare. So that takes that price kind of year-over-year price increases that they're seeing on the ACA plan to shift over into an alternatively
So talk a
funded
little
plan.
about level premium so people understand what that is, because it's a different kind of model that actually allows them to participate. And so talk a little bit about that.
Yeah, so this is a plan offering that allows for it to be kind of a quasi self-funded, but you still have a maximum liability that you can budget for.
Yeah, and so, you know, in the health insurance marketplace, large groups like 500 and above, almost 87% are self-funded. I mean, that's really but the problem has been the small guy can't do that. Okay, if you've got 15 employees, 6 employees, 17 employees, 25, you can't do that. What level funded does is it lets them get a feel for that and participate in those savings if they have a good year, and they're not penalized if they have a bad year. It's a different model the way that it works.
Right. It allows for a group to have, you're right, have access to that. If their plan is running well, they benefit from that financially.
Yeah, and if you're smart, okay, and you do things like SpiraCare, where you're going to have follow-up and you're going to have, you know, if you've got chronic disease management, if it's diabetes or it's some other issue, you know, keeping your blood pressure under control, cholesterol, all the rest of it, they're going to help you with that disease management. That's going to push down those claims, which then result in you having a better year, yes?
Yes, that's correct. And those care guides that are aligned with the SpiraCare care centers, they're really the quarterback for ensuring that if care is needed outside the clinic, that those appointments are made and those members follow through so that we don't see those claims rising because they're not going and getting that care after their visit.
Like when the type 1 diabetic misses the A1C, you know, 4 times in a row, and then their blood sugar's off the chart and the insulin's not working, and now we wind up in the ER with the big event. Yeah, and then there go the claims dollars. That's $27,000 just to walk into the ER because you went into insulin shock or whatever the case may be. So That's the point.
Yes. Keep members healthy as we can as they navigate their care journey.
Yeah, it's back to that managed healthcare model where you're actually participating with the client for their best interest, for them to do the things that they need to do.
Right.
And that's what this is really all about. So I want to recap this Humana thing again because I really want to make sure you get this. And all the brokers out there listening to this, you really need to be thinking about this now. And your clients will greatly appreciate the fact that you bring them an offer like this. So once again, they're going to be able to, if they're under 15%, now through what, June, July, there's a time limit here.
Yes, we are targeting June. So
Okay.
between now and June.
So don't procrastinate. Here's what'll happen. Y'all will wait until the last few minutes, and then everybody will swarm them and try to get this done in the last few minutes. That's typically how it works.
It is.
Don't do that, okay? So if they move now, they're going to lock down their rate through 1/1/25.
That's correct.
That's pretty significant. I mean, there aren't a lot. I don't know anybody else that's making that kind of an offer. And you couple that then with SpiraCare, which is a very different model, and you really could make a big difference for your employees until 1/1/25.
That stability is critical, I would think, to a small group.
Yeah, because that's one of the things they don't have. Stability in the small group market is just not. It's very, very difficult year after year after year, especially if they're on ACA plans where the costs fluctuate dramatically and there are no subsidies. It's a different deal if you're on an individual policy and you're getting a big fat subsidy and paying, $50 a month, $100 a month. But if you're on a small group plan, there are no subsidies, right?
Right.
So they're on their own. And that's why it really pays to take the time to take a look at these programs and find out what works for you and how it can make a lot of sense for you. If you want information, 816-395-2939, 816-395-2939, or the website bluekc.com. Do it now. Don't wait until the last minute. Okay, this would make a lot of sense. You might be surprised what you learn. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the fruited plains. Stay put. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. 12 podcast platforms. I'm not going to name them all again. There are 12 of them. Anywhere you want to go, we're on the podcast platform. It's America's Healthcare Advocate. The YouTube channel, we're on that too, America's Healthcare Advocate. So, you want to, hey, maybe you're in a broker shop with 3 other brokers and they don't even know that Blue Cross is offering this big renewal opportunity for Humana people. Have them go to the podcast and listen to the podcast. Or maybe you're an employer and you want to tell your partner, maybe that's your husband or wife, you've got a small service station, maybe you run a restaurant, whatever the case may be, go listen to the podcast. Rachel laid it all out. It's all there. And no, it's not too good to be true. They really are going to let you renew all the way through 1/1/25 at your current rate if you're under 15% on renewal. It's a big deal. All right. If you want information on it, 816-395-2939, 816-395-2939, website, bluekc.com. Okay, so I've been doing this 16 years with Blue Cross and Blue Shield. We have never talked about large group. And here sits the large group guru for Kansas City. So let's talk a little bit about large group. And by the way, if you happen to be a large group, how is that, and you're on Humana, how's that going to work?
Well, so we define large group as 100 plus employees.
Right.
So if you currently have a Humana plan, we would love the opportunity to quote on the business. So most of the customers that are in this 100 plus space, from what I've heard, potentially maybe self-funded. So we have 2 options really for those employers. So we have a cost plus option, which is a fully insured plan, but they have there's an admin and a claims component to the funding. And then we have fully self-funded, so ASO platform available as well.
So do they have access to SpiraCare?
They do have access to SpiraCare. So
connect the dots here now. You've got 125 employees, and you're on a regular PPO plan, and now you hear this broadcast and you're like, maybe we ought to take a look at that SpiraCare thing. How much of a difference could that make for somebody? I mean, just a ballpark idea of what a difference it can make in helping a large group like that control cost if they're all signed up on SpiraCare.
Yeah, so there is significant opportunity financially because the SpiraCare is wrapped by a narrow network. That could offer as much as a 13% claims savings when you look at the discounts on those claims. So if they were to move from a broad network to this narrow network, that's significant. And then you add on top of that just the member experience. So SpiraCare meeting the member where they're at along their care journey and having that low to no cost access to primary care.
So think about that for a minute. Okay, a 13% difference. How much of a difference did that make for you? Look at those premium dollars you're spending. You've got 125 employees. You've got 200 employees, and you're paying a significant amount of money. Just ask yourself, what would 13% do? Oh, and by the way, does this carry through to 1/1/25 for them as well if they sign up?
So this is a little bit different because it's likely a self-funded plan, but those claim savings are real. So that customer is paying their claims dollars, and so that discount is going to impact those.
That's pretty significant.
It is very significant.
If I could walk into a client and say, hey, how would you like to cut the cost by 13%? They'd probably be willing to talk to you.
Yes, for sure.
Yeah, that might be something they'd want to consider in today's marketplace.
Yes.
I mean, this is the second highest cost other than payroll that employers deal with. And for a lot of employers, it's a nightmare.
It is. So there's no better time than now to look at some alternative options that could drive some savings for not only the employer, but also the out-of-pocket expenses of their employees.
Yeah, and this is a great time to do that. So so let's back to the large groups again. How large are the largest groups, if you will? So your capacity to go to what?
We have groups that have over 25,000 members.
Okay, I think that covers everybody. Okay, so
yes.
So basically 100 to 25,000. There you go, people. That gives you a pretty good idea. And I've worked with Ron Miller. He works on the large group side, and some of the other folks on the large group side. So you've got a great team of people that are literally out there in the field.
Yes. Yep. So just like the small group teams, we have boots on the ground in working with those brokers. So as the brokers are evaluating what the next steps are, they know who to call, and they should work with our Blue KC sales team to evaluate what the best options are from a funding perspective, from a network perspective, adding InspireCare, lots of different opportunities to drive savings for those employers.
Yeah, it can make a big difference. Again, if you're on one of those Humana plans, you really might want to give this some serious thought. And it's interesting when you talk about boots on the ground. Every year we do the AFL-CIO car show, that Labor Day car show that they don't do on Labor Day. They do it after Labor Day, but or before Labor Day, whatever it is. And Ron always goes with me out there. And it's funny. I mean, everybody out there knows Ron. Everybody out there knows Ron. It's just remarkable to me how they all know him. They're coming up giving him hugs and handshakes, and it's just it's that connection.
Yeah. It is great.
He's their guy, and they know he's their guy. If they need something, that's the guy they're going to go to. And that's really, again, we talked about this at the beginning of the show. I don't care whether you've got 10 lives or 10,000 lives. There is that level of service here. And the customer service, and just briefly before we wrap it up here, the customer service in Kansas City is excellent. There have been multiple awards to this customer service division, yes?
Yes. We continue to receive customer experience awards. And I would say, too, to piggyback on what you said about people knowing the Blue KC team, we do have there is complexity when you're moving carriers, especially when you're a large employer and you have hundreds or thousands of employees. And we have benefit education team members that actually are educators that will go out and meet with employees or have virtual webinars to educate if there were a change from Humana to Blue KC.
They can make it happen. If you want help on it, 816-395-2939, 816-395-2939. BlueKC.com is the website. If you're a broker, you need to get on this. If you're an employer and you have questions and your broker hasn't said anything to you, pick up the phone and give them a call and get somebody out there to tell you what's going on. 816-395-2939. You've done this once. Now you're roped in, so you're going to be back here again, just so you know.
I cannot
Christina's
wait.
sitting here going, yes. Okay. And now, ladies and gentlemen, I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken in today's environment. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.